hours. So I'm not going to waste time trying to mess with that. Again, your two most common mood disorders, bipolar and major depressive disorder. This is a very busy slide, but again, some students, it's not updated. Some students like it just to, look at all the different stuff, such as safety, nursing interventions. It's got a lot on it. So those of you that are maybe visual, you can look at that. I did put just a little, because again, my focus is pharmacology, but I did put just a little bit about major depressive disorder, again affecting over 19 million Americans. And you can see it doesn't always, patient may not always present as, I feel down or I feel depressed, especially your elderly. It will often present with physical symptoms. Okay? They have this pain, that pain, my head hurts, and that can be depression. Okay? These are, actually you can find these in the farm book. I just put them in because, not so much to look at that, but for those of you that may be like confused about how serotonin, that reuptake is accomplished, you can just look at this. It gives you normal and then what happens so that you have more serotonin in the body. Okay, so I'm not going to... Okay. So again, I went over SSRIs. I listed some that you may see, whether that be in the psych area or in the acute care setting. Celexa, you can see the params. I'm trying to get you to look at classes, things that are similar. Lexapro. This was one of the first that came out. Prozac. Okay, I don't see it that much, but I have seen patients who've been on it. Paxil is another one. And there's a lot of them. Zoloft, Luvox, and Vilazodone. This one I haven't seen that much, but you may see it. All of those are considered SSRIs. Remember, need to know. Takes 3 to 4 weeks. They have black box warning. Watch that patient while they're starting their medication. They will often say it's not working, and they'll stop it. They'll try add something else. Remember, that can result in serotonin syndrome. Okay, so needs to knows. I think I went over this, and it was in 2004. I think it was somebody killed their family, and they linked it. They said it was linked to an antidepressant they were on. How much truth that is, I don't know. But FDA issued a black box warning for all antidepressants. Okay. Again, I mentioned one of your big side effects listed in the literature, which is a decreased libido. Common, I have listed out for you. They can also result, I don't think I put that on there, but anorexia as well as weight gain. Less chance, though, with our SSRIs and our SNRIs. Again, that is why they are most widely prescribed, because we are finding out they do have less chance of side effects. Again, this can be while they're on the medication. It can be in the first few weeks. Be very, very careful. Jennifer and I were talking about, how a patient seemed really happy oftentimes they say, guys, why do they become really happy? They have finalized their plan. They're now happy that they have made that decision to take their lives and the plan is in place. And they feel, I guess, free. They're happy about that. Almost relieved. We had a patient in the VA. She told the student that she had a plan and she was very disappointed it didn't work. Okay, and she tried to commit suicide again. So, again, we talked about serotonin syndrome. You cannot mix these meds with another antidepressant or be very careful of herbs. Because this can cause serotonin to accumulate. You know how I hate this thing. There. Again, I mentioned some of the side effects. Here are more. A lot of educational needs that you as a nurse would be responsible for. Okay? Everybody good? Follow me? Okay. Yeah, I'm just going over, making sure you're aware of what's on the slide. This is just another one. Again, it just kind of gives you normal and then kind of tells you the whole action as far as how the MAOIs work. You know, I didn't want to turn this into Pharmacology 101 because I want you to be more focused on the need to knows as a nurse. And our MAOIs, what do we have to be careful about? The foods with taurine, okay? And here's another one of those little visual tools. And also, a lot of students like mnemonics. And again, when you're looking at your MAOIs, those most common are Nardil, Parnate, and Marklin. And again, no popular meds. Sometimes students find those mnemonics to be helpful in trying to learn the different meds. Okay? Also, these are just your visuals. You know, he's talking about the hypertensive crisis that can occur when eating or drinking certain things that have taurine in them. Again, these are old drugs. They still may be out there. Okay? And probably, again, with your hypertensive crisis, if your patient were to eat foods with taurine, oftentimes they can use calcium channel blockers as an antidote. MAOIs, old drugs, but still in the literature. I listed just some of the pictures. You can look in the farm book. I know probably in your psych book there's some listed too. But it's a lot. It's a lot of foods, guys, that these patients cannot have because it will interact with the MAOIs and cause a hypertensive crisis. So, not good. And it's a blessing that we have newer meds out there. Okay? And just some cute little pictures you can look at. I did list them for you. Again, remember, no problem meds, however, or you can look at this. However, you do want to be able to recognize your meds in the class. Okay? Do you have to know every single one? No, but if I have it up here or if I said something about it, it might be good to know. Because I'm not going to put, a patient taking Marplan or whatever, MAOI. Because boards isn't going to do that. Okay? You've got to have some idea of what falls in the classes. But the result is the same. Still, some of the more common side effects that I mentioned with the antidepressants and the other side effects with the antidepressants. This, again, with the food, is solely for your MAOIs. Okay? Taking that with foods that have tyramine, which is an amino acid. Okay? So that's solely for your MAOIs. That's pretty similar to your others. I mentioned St. John's wort. That's probably one of the more common antidepressants, or herbal, I should say herbal antidepressant. Your tricyclics, again, they are your older meds, but still out there. Again, just I put these in here, so if you were like one of those, sometimes I have those, or like I want to know how it works. These just kind of summed it up very nicely for you, and how they affect mood. Okay? But as nurses, we want to look at some of our more common. This is probably one of your more popular tricyclics, Elavil, okay, or amitriptyline, okay. And notice I'm trying to highlight some of the consistencies. Bipolar is another one, but Elavil is probably the more common one that I've seen. So those are some. And again, I will always reflect back and always try to pull those from my slide as I, are writing your questions. So you're like, you didn't mention that. Not that that may not happen on boards, but, always read the question and see what it's asking you. And when you're studying pharm, this is truly one of the better ways, is people look at the similarities in their names and identify classes. This is just more info. Cinequan, I've seen. They have been used for childhood bedwetting, in particular this one. Right here. Again, I mentioned that very important. This is exclusive to TCAs. Okay, I'm not saying that couldn't happen, but again, when you're looking at the literature, theory-wise, this one is exclusive to the TCAs due to that alpha blockade. Is everybody with me? Good? Okay, this should just be another refresher for your foundation. They're often listed as atypical, but I like to call them SNRIs because they're serotonin norepinephrine reuptake inhibitors. These are very popular. These can also be used for other things. As you can see, we give quite a bit of Cymbalta for neuropathic pain. And these are listed, again, under your SNRIs, okay? Your Cymbalta effects are great for depression and anxiety. These are, again, along with your SSRIs, some of the most widely prescribed meds for depression and maybe anxiety. And again, Cymbalta has been used quite a bit with neuropathic pain. Wellbutrin, as you know, has been used for smoking cessation. Has everybody heard of Wellbutrin? Okay, yeah, I've known a few people that have taken it. I'm going the wrong way. Okay, so that's a very brief overview. Again, if you were listening in the beginning, you should be good. Okay, you probably need to study that. some before. You take the bipolar depression test. Again, you'll want to focus on those. Lithium, of course, your antiseizures. Yes, I got the bulk of them. Antiseizures and atypical. And then, of course, you're going to hear more about the antipsychotics with like schizophrenia, etc., etc. Okay? Mood disorders. Bipolar, once known as manic depressive disorder. Actually, guys, with the most worrisome type of bipolar is when you have what's called rapid cycling. You go from mania to depression, mania to depression, mania to depression. That is the most dangerous type and the highest risk, as I said before, for suicide. I don't even know if I can get this to pull up. If I can't, that's okay. Can you see it ain't all right. And I don't ever play on mine. I'll get something wacky. All right, this must be. Just extra. Just FYI, is rapid cycling, mania and depression, which is what Demi Lovato had. It is also Robin Williams and Jim Belushi. Two of them are dead. These patients, again, their activities can be from goal-directed, like Demi Lovato, to spending every dime they have in their manic state. Okay? And they don't eat, and they don't sleep. They go for days. They don't eat, they don't sleep. And if you look at Demi Lovato before, and you look at her now, she was quite thin. And now she's put on some weight. Again, I mentioned lithium. I did this. This is just something I found to kind of help you remember what we discussed about lithium. You can see it's lithium. It talks about the therapeutic effect. That's very, very important. Why? Because it's toxic very, very quickly, because that is a very narrow range. I is mania. Toxic levels greater than 2, you can die. Important to hydrate. Why? It acts like a salt in the body. You will have dry mouth and some of the more common side effects. Again, I mentioned you can give mannitol. Very important for patients to know they must maintain a normal diet, but especially in this country, it's very easy to get salt if you haven't noticed. But, they need at least a 2 to 3 gram per day. Why? Toxicity. Okay? If nothing else works, you will have dialysis to get out of your system. Any questions about lithium? I will tell you, when I'm looking at the NCLEX books, you see several about lithium. It's an old drug, but it's still widely used. Antiseizure, what did we say? It's important, need to know. Metabolized solely in the liver, and assessing levels. Anytime you have something that's solely metabolized in the liver, you better be watching levels, okay? I mentioned the 2 that, again, have been identified in the literature that help with mania. This one, Lamictal, they say it works actually better with depressive disorder. Again, usually these meds are given in conjunction with lithium. But all I can say is about time somebody figures out some newer drugs to treat bipolar because of the problems with lithium. Toxicity, I guess I should say. Okay, so those are the biggies right there. You good? Okay. We mentioned liver levels. These are some of the others that you can see. Do you know what Stevens-Johnson syndrome is?
Yes. It's like a rash.
Skin rash? That is a major problem with lamictal. Okay, I'm trying to point out some of the biggies, okay, that need to know. And yes, it can occur with antiseizures, but the one thing I've noticed is especially with lamictal, you have a greater chance for Stevens-Johnson syndrome. This, all you have to do is remember, it solely metabolizes in the liver. Everybody should know what the liver does. So therefore, you can have increased bleeding. You know, it can build up in the body, and it can affect, of course, your H&H. Okay. So if you just kind of think about the liver with your antiseizure. Our newer generation of antipsychotic, your second generation. This can be combined with lithium, again, for mania. When you think of these drugs, though, a lot of you probably think of schizophrenia or schizoaffective disorder. Okay? These we see quite a bit. Zyprexa, Risperdal, and Seroquel in the acute care setting. What's the problem with antipsychotics? Need to know. What was it? What does it stand for? Extrapyramidal symptoms. What is this? Tardive dyskinesia. Okay. More likely to occur with your first generation, but obviously can occur with second generation. And they cause waking. Okay, if you remember me standing up here going, I'd rather be hallucinating than Again, your antipsychotics we often think of schizophrenia or schizoaffective, but again, those that I mentioned can be combined with lithium to help with mania. This is a brief FYI. You will get, of course, another class about schizophrenia, but just to let you know how we come up with this diagnosis, you must have delusions and hallucinations. Okay, or disorganized, I guess you gotta have one of these. And then these. Oftentimes we see hallucinations. And Kayla's patient was paranoid, right? Paranoid schizophrenic. Hallucinating that everybody was talking about him. And everybody was looking at him. You will see those older drugs. And in fact, I think Kayla's patient was on Haldol, correct? Okay, and that is your first generation, remember? Antipsychotic. Much higher chance of the EPS and the tardive dyskinesia. Okay? Yeah, you guys see how hard this test would be. It'd be awful. I'll be killing me. And I'm just seeing with your antipsychotics, we talked about the major side effects and non-compliance. Which is why we often see a lot of our patients with diagnosed mental health disorders, we see them back again and again and again and again. Especially those that have a dual diagnosis. They will take their money and go buy what makes them feel good. Right? Like I said. It's why they don't cost money. You know? So why not? Instead of taking their medicines. I mentioned this. I mentioned there's a couple of others. Haldol is probably the most common that we see. It can be given by mouth or IM. These are your second generation, less chance. So that is why they are used more. Should be used more this day and age. And as I mentioned, here they are. There's Zyprexa, your Risperdal. This one is the one listed under that dopamine stabilizer. Again, if you'll just think third generation for Abilify, why? It's newer. As we get better with our medications, we are looking at less side effects. Not saying that it couldn't happen, but again, less chance. And that's important in trying to enforce compliance. Like I said, don't want to be anxious, so you're going to take what? Xanax. What class is that? Benzos. Your benzodiazepines. Often with major depressive disorder, we have anxiety as well. Your benzos. These are your older ones. Valium, Lithium. Transine's pretty old. The two that we see the most are Xanax and Ativan. Okay, we run Ativan drips in the unit. So you're like, no anxiety whatsoever because you're so sick. But these are considered your anti-anxiety. Problem, you can become addicted. And what you needed one pill a day for, you now need more and more medicine. Again, what do they do? So take your anti-anxiety and have you 6-pack. Problem is, you also run the risk of not waking up. Yes. So. This one is out there. I put it up there. I don't see this used a lot in the acute care setting. This is one. Somebody you know may have it. It's not as addictive, but it can be used for anxiety, and that is Boost Bar. Does anybody know? Ever heard of Boost Bar? No. You've heard of it? Mm-hmm. But it is classed as an anti-anxiety medication, but it's less addiction, but still can work for anxiety. Okay, don't see that one much in the acute setting. Okay. And again, major less chance of addiction with Boost Bar. So you may think, why doesn't everybody take Boost Bar? Huh? I know. I have no idea. I have no idea. Probably cost. Like everything else. You can probably get Xanax for dirt cheap. Mm-hmm. And now we're going to the dual diagnosis of substance abuse. Probably the easiest way to look at it is how I have divided it up. You're going to look at your depressants and you're going to look at your stimulants. Okay? That is probably the easiest way. And your painkillers. I should have wrote out painkillers, but I didn't. So those Probably the easiest way to look at it. Okay? Now, let's drink. You can go to CVS now. And guys, it is so funny. Because, I don't know. I'm very attentive to this stuff ever since I started teaching it. CVS, I used to look and I thought, gosh, all you can get is this old cheap wine. Well, now they're starting to sell better ones. Instead of Bud Light, you can get St. Pauli's now. I mean, you got the whole dang side now is the alcohol section. This is at CVS, so I can go and pick up my medication for depression and anxiety, and then I just grab me one of these. One-stop shop. Like I say, it's everywhere. Stop and look and pay attention. It is everywhere. Everywhere.
Only in the South, though. Some states have drugs.
Only in the South? Well, we must love to drink, and smoke our cigarettes. Huh?
Sweet tea flavored vodka.
What? Oh, yeah, I remember the first time somebody said, I'm ordering an iced tea. And I was like, oh, okay. Holy moly. I was like, what's in this? That would have knocked me on my rear end, Oh, my God. And we have such great names for them, too. Right. Sex on the beach. Who ever heard of sex on the beach as a drink? What's that one? They got the beer. And you may know, how do I know this? Okay, why you... Don't ask. Sure. They got the beer and then they take this thing. What? Oh! I'm sitting there going, you are kidding me. I was like, no. There I sit with my little glass of wine, and they're dropping these things like bombs. I'm like, holy moly. Oh, God. If you notice, some places now, I swear the mugs are getting bigger. I swear they're getting bigger. Now, for my little glass of wine, I still seem to only get this much, right? But sometimes I'm like, I wish I liked beer. I mean, I'm getting a big mug this tall now. I couldn't lift it, my arthritis. I mean, having to sit there with two hands going, no, it wouldn't work. It's everywhere, is my point. I can see why it's highly abused. Things that you may see on NCLEX. Okay, that's why I put it up here. As you know, there are certain medications that can deter from drinking. One of the most common is antabuse. Why? It's unfortunate, but it can make you violently ill if you combine it with alcohol. And that is not just alcohol, drinking. It can be alcohol within mouthwash or whatever. So, if there's an alcoholic on antabuse, which they may be, they should be very aware of how sick it can make them. And they need to be very conscious of alcohol within some of our over-the-counter products. And it has a long half-life. As you can see, it can last for 2 weeks. Very long half-life. Another one is Campril. Help with alcohol abstinence. Again, these are generally used in patients who are, they will tell you they're alcoholics and they have gone through rehab and now they're clean. And oftentimes they're on these types of meds as well as some of your antidepressants. I know you can't see that, but just FYI, it does affect the entire body. If you abuse it. These are not used that much anymore, guys. Why? Highly, highly addictive. And they've been replaced by benzos. Okay? Your barbiturates have been replaced by benzos. Why? They're dangerous. Okay? Especially with withdrawal. You can die from the actual withdrawal, which is true of several of those meds, but that's why you just do not see a lot of these anymore. These were back in the 50s and 60s. So benzos are your more common. Still high for abuse. I went over. I've listed several for you. Trying again to highlight some of the common keys with the classes to help you with that. Some of these medications can be used for sleep as well. And now the fun stuff, the stimulants. If you didn't know, or if you know somebody with ADHD, we actually give stimulants, certain stimulants, to help them with hyperactivity and focusing. And I threw those in there, okay? I don't know. Did y'all talk about ADHD and PEDS? Yes. Okay. Just a cute little chart. Most of you can probably figure out the difference. Like I said, I want to fly, man, with these stimulants. I want to be high as a kite. Nicotine, as I mentioned, very, very common. It's legal. Right? Easily accessible. Used to be. Now it's what? Behind the counter. Used to be somebody come up to me when I worked at the drugstore. I didn't care how old you were. I'd give you a pack of cigarettes. And that's kind of changed now because of our current research and evidence-based practice. As you can see, a lot of places now are what? Smoke-free. Smoke-free. Which is, I get to see my students standing out on a cold day with the smoke going in there. It's a stimulant. It does affect the entire body. You know what? This is probably not going to work. But this is so funny. I hope you can get it to work. It is. I started reading. I know. That's okay. They can do that at home. Anyway, I started reading all about this death by caffeine. And it was hilarious. So I started putting in and if you guys can pull it up at home, I can pull it up in my office, but you pull it up and it gives you this little chart thing. So you put in Monster. So I put in Monster sports drink. Then you got to put in your weight. And I would have to drink, for my weight, 47 Monster drinks. Which I would puke before that, right? But I would die. And then, Kristen, I put hers in. Now, Kristen would have to drink, she could drink a lot more, but it was 76 Monster drinks. So it's kind of interesting because I kept going, how can you die from dang caffeine? I can see how you could get jittery and all that stuff.
Double click on it.
Oh, does it? Okay. Well, that's okay. If I can pull it up here, y'all. I think it's this computer, but anyway, if you have it up, double click. It's just funny to do. You can put in whatever drink. This is mine. Okay, you put in whatever drink, and then you put your weight, and you can see how you can die by caffeine. And I just thought, I wouldn't want to die by caffeine.
I know how I love my diet. 316 cans over 316? 316 cans of Dopamine.
Oh, okay. So, you pull it up, have fun with it. It's just a funny little thing. These were actually popular in the 60s and are now abused. Like I said, if you'll remember, Miss Rumble's got to show her dang driver's license to get her pseudoephedrine so she can breathe because you people are out there making meth labs. And it's illegal. And what happens is these people come into the ED and they are nutso and they have potential to die. And so the FDA says, we're going to make it Schedule 2. Okay? Problem is, again, is if you read, it's not pure. People have learned how to make this stuff, and it's not like pure stuff. I did throw in a couple of meds in regards to ADHD. I know you guys probably talk. They're stimulants. The oldest one, Ritalin, Adderall's common. There are others out there. Okay, I'm not going to spend time on that. I want to fly. Highly abused med. Why? Oh, it makes you feel good. Empowered. Euphoric. Again, if you'll remember, they can come into the cardiac care unit because they are racing and they can't breathe. Because their heart's racing so fast because they have snorted so much coke. Highly, highly addictive. Okay? Again, another one, there's impurities out there that's probably more dangerous than getting the pure substance as far as problems. Okay? Highly abused. Again, this is another one. It shows some of the more common narcotic painkillers that are abused. I mentioned a lot of them. Oxy is one. Hydrocodone is another. There's several out there, so you guys can pull that up. Opioids for pain. Again, these are the pure ones. Tramadol, Jeff was looking up, is synthetic, so it's like me. These are from the pure poppy plant. Do any of you remember paregoric? We were drinking opium. Do you remember that? Our mom, you could K-pactate into paregoric. They were giving us opium because we were doing so bad. I think it was hilarious. Well, boy, that stopped. You couldn't find a ball of paregoric if you tried. Do you remember that? Huh? Oh, yeah, put it in baby's gums. Yeah, we just give them opium. That stuff will stop you up big time. I'm not kidding. It will stop you up. Morphine, codeine. It will. Ask your parents about paregoric. You may have had some. That's right, we turned out just fine. Here are some of your opioids. Heroin is highly abused, Vicodin. Problem with these meds, as you know, in the hospital is respiratory depression, which is why my rule of thumb, I told students, as you become new nurses, you can always give more, but you can't take it back. So always err on the side of caution, especially with your elderly patients, especially patients with renal and liver problems. Okay? I put these up there, guys, just so it's FYI. There are meds that we can give. We had a patient in IMC that went through rehab and was on this medication. So these are there are meds out there for help keeping these patients clean, I guess I should say. If you've read a lot, Narcan can now be carried by your police officers when they see heroin overdose. Okay? They will give them Narcan. Okay? Everybody know what Narcan is, right? Okay. What did y'all say? Again, it can, it's an antagonist, so again, if they're overdosed and they're having very, depressed respirations, they can give them Narcan. Some of this is FYI. It's just, this is so funny. I hope y'all can, I wish y'all could pull this up. This is absolutely hilarious. It's the only clean one I can find.
Yeah.
Okay, do what?
Get out of the fine check.
Okay. Get this okay. Yeah. All right. Now if I go down, this is just amazing.